Hello guys, welcome to my channel once again where we make videos that cover all you need to know about medical doctors and medical students. If you're new to this channel, please do well by subscribing and turn on the bell notification so you don't miss my new videos every Saturdays. And to my returning subscribers, I really appreciate you. Thank you for coming back once again. Welcome to the third episode of the Questions Doctors Would Love You to Ask Them series. And in today's video, we're going to cover questions doctors need you to ask them concerning your surgery. Have you ever heard of the word tomophobia? Let me define it in case you haven't. It's simply the fear of surgery or fear of any medical procedure. And this is something that is very common. I think almost everybody has that fear. Surgery is something that usually elicits fear within us. Even for medical personnel, trust me, most medical personnel are way more scared of surgery than you think. So if the word surgery is being mentioned to you, and you get scared, just know that you are not alone. But know that a lot of people have gone through it and are doing well. And these questions that we're going to cover will help you to be able to tackle it. As I had mentioned in my earlier videos, the main aim of this question series is to help you to ask the right questions so that you'll be well informed about what is going on and be better prepared for it. Let's dive in. Let's quickly define surgery. Surgery is a medical intervention or operation done by altering the physical structure of the body in order to achieve a desired health outcome. It is a branch of medicine itself. The structure can be altered by either removal and or destruction of that particular structure. So if the structure is a deeper structure, it could be accessed either through open body cavity like the mouth, the anus, or the urethra itself. But then sometimes an incision has to be made, that's like a cut has to be made to be able to penetrate and access deeper structures. However, there are some surgeries that are non-invasive where no instrument needs to enter your body cavity itself. For example, radiotherapy. Surgeries are done broadly for two purposes. The first is to help diagnose a disease, for example, a breast lump biopsy where a lump is being removed from the breast and then further examination is being done to confirm whether it's a breast cancer or not. And if it's a breast cancer, the cancer is being staged so that the appropriate treatment can be effected. The second purpose is for therapeutic purposes, that's to treat the disease. There are some diseases that treating them with drugs alone is not feasible. So the structure in the body will need to be altered to be able to effect that particular treatment in itself. The first question you want to ask your surgeon concerning the surgery you're about to undergo will be, what's the name of this surgery? Every surgery has its name, and many times you might be intimidated by the name, by the pronunciation, but please don't be. If you cannot even pronounce it, bring out a piece of paper and ask the doctor to spell it out for you. A lot of surgeries could be done in a particular organ itself, so you knowing the name of the procedure will help you isolate it. Maybe subsequently, your past surgical history will be needed, and this will be easier for both you and the doctor that is trying to get that. Please note that the length of the name does not necessarily mean it's complicated. For example, marsupialization of the Bartholin cyst is a very minor procedure that could be done within 15 minutes and the patient could even go home. Whereas a surgery like amputation of the limb might sound very simple, but then it's a major surgery that would need at least 45 minutes depending on the expertise of the surgeon performing it itself. So please, it's very important that you ask for the name of the surgery. And apart from the name, you also want to know how the surgery is being done. Many times our surgical names actually give out the main surgical procedure like appendectomy or hysterectomy. Appendectomy is the surgical removal of the appendix, and hysterectomy is the surgical removal of the womb. Don't assume. Ask the surgeon to explain what the surgery is all about, and the surgeon is obligated to explain everything for you. If you don't fully understand what is happening, we could break it down for you in lay terms that you'll be able to understand it. The next question you want to ask is, must I have this surgery? Note that for every surgery, there's usually at least one indication for it. A doctor doesn't just recommend a surgery for you. There are usually reasons which we clearly state and we explain to you. So please ask whether it is necessary for you to have that surgery and be convinced beyond reasonable doubt that that is the best alternative at that moment. And at this point in time also, you could also ask if there are other surgical options or medical options. If you have a good doctor, usually the doctor chooses the best for you. But then you also ask and you arrive at that conclusion together. Then you don't force anybody to do whatever he or she does not want, especially for adults or those that can be able to make rational decisions on their own. You don't force them. Even for those that cannot make those kind of decisions, there are usually words that will have to agree for them. So it's the job of the doctor to be able to convince you as to why he or she is recommending this surgery as an option for you. Please ask. The next question we want to ask is, who is the surgeon that's performing this surgery? The doctor will be named. Maybe the doctor that had seen you at that moment might not necessarily be the one to perform the surgery. And you want to know how experienced the doctor is and how his or her success rate is. It's very important you know that, especially if the doctor that will be doing the surgery is not the one that had given you the diagnosis and had recommended the surgery for you. It's extremely important. You could even ask to see the doctor and ask the personal question. This can be arranged. Your mind needs to be put at ease before you go under the knife. Or for every surgery, there are qualified surgeons for that. There's nothing wrong in going for the best. So far as you can afford it, you can just try it. If you have any reservation concerning the doctor that is doing that, please, you can state it. You can refuse it. And you can also research. Another question you want to ask will be, who else will be involved in the surgery? Every surgery has at least a surgeon. The surgeon might have an assistant surgeon. There's usually an anesthesiologist or anesthetist. Could be an anesthetist nurse. And then there are usually scrub nurses or scrub tech and an assisting or rotating scrub nurse or scrub tech that could help give other things too. You want to know which people are going to be there. In some institutions like teaching hospitals, students might also be involved. So it's very important you ask that too. If you have any reservation, see how otherwise can be done. Little people are being allowed into the operation room. But most times you might not have that power itself, especially if you're in a teaching hospital. It's necessary that the medical students are also around. So whatever rearrangement could be made will be made. The next question you want to ask will be, when am I having the surgery? It's very important. Surgeries are broadly divided based on time into emergency surgeries or elective surgeries. Emergency surgeries are surgeries that you need to have as soon as possible, like immediately. If you don't do that, either the patient dies or the health condition at that moment worsens. Then elective surgeries are surgeries that can wait. Some can be postponed for weeks or months. You want to know the urgency of the surgery itself so you can be better prepared for the surgery. So ask if the surgery can be postponed, can be rescheduled for another time. In case the timing is not convenient for you, you can plan appropriately. However, if it's an emergency surgery, it means that you must have the surgery at that moment in time, or else it will be worse for you. The next question you want to ask will be, what are the associated risks or complications of this surgery that I'm about to undergo? This is usually a very difficult question to ask. A lot of people are fearful of what is going to happen. But a doctor is being trained to be able to break these things down for you and assure you that the best options are being chosen for you to undergo this surgery. Please note that if the surgery is going to make you worse compared to living with the disease, surgery will not be recommended. There are usually risks that are associated with surgeries, and the doctor will be able to tell you about them extensively and reassure you about them. There are some complications that doctors anticipate and will prepare adequately for them. So for pains, painkillers or analgesics are being given, antibiotics are being given to prevent infections. Then there's sometimes the risk of surgery itself is having thrombosis. So thrombolytics are being given to be able to curtail that. The doctor is not just thinking about you on the surgical couch or on the surgical table. The doctor is thinking about you before, during, and after the surgery itself. So you're covered. Just know that we always have your back in terms of that. Before any surgery is being done, there's what we call a consent form that is being given to you. And the consent form contains or usually includes that you are aware of what the complications might be and you've accepted them. There's no way you can sign that if you've not been reassured by your doctor. It's usually an informed consent. Doctors would not lie to you. A good doctor does not lie to you about this. So whatever the outcome is going to be, we will let you know about it. The next question we want to ask will be, how much does the surgery cost, especially if you're going to pay for it? This is on financial grounds on its own, so that you can make proper financial plans for it, especially if it's an elective surgery. But then if you are being insured, you want to know the kind of coverage, whether it's fully covered or it's partially covered or it's not covered at all. This is extremely important on financial basis purely. The next question you want to ask will be, what type of anesthesia will I be given during this surgery? There are 4 types of anesthesia. There's the local anesthesia, there's the regional anesthesia, there's the sedation or monitor sedation, and the 4th one is the general anesthesia. These are they range from minor to major surgeries on their own. The local anesthesia is for minor cases where maybe a small part of the body needs to be operated upon, like a lump. So the surrounding region is being anesthetized, so the patient does not feel pain. In this case, the patient needs to be fully awake. For the regional anesthesia, a part of the body is usually anesthetized. The person doesn't feel pain in the entire part. It's done for surgeries maybe involving one of the limbs, the upper limb, the hands, or the legs, and it's being done for cesarean section. So the sedation or monitor sedation, it depends on the surgery. Maybe for something like colonoscopy, that the patient will need to be sedated, needs to be calm, but does not need to be fully unconscious. So it depends on the degree of sedation that is being desired. It's usually to calm the patient down. And then the 4th one will be the general anesthesia itself, where the patient needs to be totally unconscious. It's usually for major surgeries. If you have any reservations, you want the doctor to know. If you prefer any type of anesthesia, you also want the doctor to know. But it doesn't make sense that you want to be under general anesthesia for a minor surgery like a lump removal. It doesn't make sense. The next question you will ask would be, for how long will I be in the hospital after the surgery? The reason why we keep patients after surgeries in the hospital is to monitor them. So for some patients, especially if patients have undergone a major surgery, want to monitor their stability, want to ensure that they are being given their drugs. We have to ensure that they are okay and fit to be able to go home before we discharge them. Maybe for surgeries that are serial, you might be around for a couple of months. This is very important for you to know so that you can plan adequately to be available for the surgery. Most minor surgeries usually do not require hospital admission afterwards. The patient is just observed and then sent home. But whether you've been admitted or not, whether it's a major surgery or a minor surgery, you're being followed up at the clinic continuously following discharge, and appropriate interventions are being made to ensure that you make full recovery or make the best recovery possible. The next question we want to ask will be, after my discharge, what do I need to do or what do I need to stop? For minor surgeries, you might not really need to do much except to care for maybe the wound itself. But for major surgeries, there are a lot of things you might need to do. You will need to adequately rest. You will need to take your medications. Following some surgeries, you might have to go for some rehabilitations or physiotherapy. You have to ensure that you do that. The doctor will be able to explain to you what will be required of you after the surgery, and you would know what it is and plan adequately for that. Then the last question to ask will be, how long will it take for me to make a full recovery? There are surgical procedures that you will not even be incapacitated in any form. But for major surgeries, you want to know how possible that will be or how long that will take. There are some surgeries that you will never be yourself. For example, amputations. So you will need rehabilitations, you will need prostheses and the rest. But for some, you might be limited for a while, but then will be able to be your optimal self after some weeks or after some months. You will need to be absent for work for a while, but after a while, you'll be fully fit to do whatever you want to do. This is to help you also to plan well for your future. So that's it for the question you need to ask your doctor concerning your surgery. Which of these questions did you find more fascinating, or which of these questions did you have a lot of reservations towards? Please let me know in the comment section below. If there's any other addition, if there's any question that you think I've missed, please let me know about it. I will answer you as soon as I can. Don't forget to like this video and share. And if you are not yet subscribed to my channel, please do so and turn on the bell notification so you don't miss my new videos. Thank you.